I want to go ahead and bring in Dr. Pablo Bedano now to the conversation, one of Community's MD Anderson certified physicians. Dr. Bedano, from a physician's perspective, what do you think this affiliation with MD Anderson Cancer Network means?
I think it's very important for us because at Community, our emphasis has always been on patient care. Teaching and scientific research have been secondary goals. And so we recognize that to provide good patient care, we need to adhere to strict scientific guidelines. And so being associated with a large cancer center as MD Anderson allows us to have direct access to all the research that's done there and all their experience from the large number of patients that they see, including rare cancers or rare situations within common cancers, for us to be able to provide that excellent care that we aim to provide here in Indianapolis at community hospitals. It's just really great to be able to tap into all their experience and all their scientific research.
So when you talk about guidelines, how can we explain that to the general public, the things that the doctors are working from, these very high guidelines, and how are they taught in general to our physicians?
Well, guidelines means that panels of experts in one specific disease meet together and they review current scientific data, the current evidence on that particular disease, and they come up with a certain number of things that they feel should be done with every patient, that they're a minimum standard of care that should be followed, plus suggestions on how a disease should be managed or what diagnostic tests should be done. And so as far as for the community physician, this is very important because that allows us to make sure or ensure that the care that we're providing is up to date and follows what seems to be the most successful pathway in improving patients' health.
So if we look at cancer patients specifically, how will the care change for them? What can they expect when they come to visit us at Community Hospital East or North for care? And are the standards more about better outcomes?
Well, I think the patients can expect that we will continue to make their experience with the healthcare system and with their doctors the best possible, that they will always have their doctor available to them, that they will always have nurses available to them when they have problems, but that they also should know that the treatments that they're getting, the protocols that they're getting are based on a much larger system and a much larger experience than that which the doctors in Indianapolis can provide. And also that the care, by following the guidelines, has been standardized to a point that most doctors in the community network should be meeting those at least basic standards of care that we feel are so important.